Good morning, ladies and gentlemen. I'm Randy Saplina, and I'm here today to talk about DVTs and how they're going to help you explain to your patients while you go into the workforce, and how you can help prevent your patients from getting a DVT, which is also known as a deep vein thrombosis, while patients are in the hospital. Patients can get deep vein thrombosis because they were either immobilized, in a bad car wreck, had a surgery, or just they don't ambulate like they're supposed to when they're in the hospital. A DVT is a blood clot that forms in the body and it gets stuck in a part of the body and it can't move. And it's not passing like it should. So I'm proposing this to you students and your senior level class because you're going to be the ones that are graduating soon, and you're going to be the ones that are going to be going out into the world and helping us nurses prevent these DVTs, because DVTs can cost a lot of money, and it will help have these patients stay in the hospital for a longer amount of time, and we need to stop these DVTs from happening because it's something that we can prevent. Not all DVTs are prevented, but a lot of DVTs are prevented because a lot of times we as nurses can get our patients up and moving. We can get them in a chair. We can do things so that our patients are not just sitting or laying in bed every morning. My goal is for me to teach you how to prevent these from happening, and for you, when you're out in the clinical setting, to get your patients up and to remember that today I want to make sure my patient is not going to get a DVT. So some goals that I want you to think about every day when you're in the clinical setting is that you're going to be able to properly document education of a DVT prevention. I also want you to be able to properly distinguish which patients are at higher risk for DVTs and ambulate these patients first.